This is my audience. My entire political career, I voted pro-life, and that is exactly why I favor the stem cell initiative. I believe in saving human life. I want cures to be found. This is a quote from U.S. Senator Orrin Hatch of Utah in 2006. After President Bush made the decision to veto federal funding for stem cell research using human embryos. Hearing quotes such as these one are incredible to hear in light of the fact that they open our minds to want to understand more thoroughly about a medicinal practice. It is extremely important that everyone be very much educated about this issue so that they can start to build up their own feelings about medicinal morals explicitly in regards to stem cell research. Lots of people, including myself, have grown up and have been raised to believe that one must not play God, that one must not alter life or anything on earth. But I have frequently wondered about this practice, such as stem cell research. I have always wondered, well, if we have the ability to save lives, to make the world a better place, why don't we? Why aren't we allowed to do that? Questions such as these should fuel our minds to look further into a controversial topic and decide for ourselves if the pros outweigh the cons. I have taken it upon myself to teach not only those who may not be familiar with the practices of stem cell research, but of those who are going into the medical field as well. In this discourse, I would like to share with you exactly what stem cells are, the different types of stem cell research, and their potential role in disease therapy, and the ethical controversy surrounding stem cell research. First, we will start with explaining what stem cells are. So you should know the different types of stem cells and their potential with the required research. Stem cells have the momentous potential to form into a wide range of cell types in the body amid early life and development. At the point when a stem cell divides, each new cell has the potential either to remain an undeveloped cell or turn into another kind of cell with an increasingly particular capacity, like a muscle cell, a red blood cell, or a brain cell. In other words, stem cells are mother cells that have the potential to develop into different types of cells in the body during early life and growth. Embryonic stem cells are derived from embryos that develop from eggs that have been fertilized in a vitro fertilization clinic. They are usually donated for research purposes with informed consent of the donors. They are not derived from eggs fertilized in a woman's body. Embryonic stem cells are undying and have a practically boundless developmental potential. They are exceptional cells that have the capacity to form cells ranging from muscle cells to nerve cells to blood, conceivably any cell type that makes up the body. According to Jennings Yu and James A. Thompson, they are essentially an unlimited supply of specific cell types for basic research and for transplantation therapies for diseases ranging from heart disease to Parkinson's disease to leukemia. According to the Boston Children's Hospital, adult stem cells produce the various types of cells that keep up the body's tissues and organs, and significantly, they can separate and recreate inconclusively. There's this thing called regenerative medicine, which these cells could fix, damage, or counter a disease by giving more insulin-delivering cells to individuals with type 1 diabetes, for instance, or cardiovascular muscle cells to help individuals recoup from a heart attack. At this moment, researchers are not able to develop the cells in the sums required for treatment. More work is likewise expected to discover functional approaches to guide the various types of cells to where they're required in the body, ideally without the requirement for medical procedure or other obstructive techniques. A lot of these promises that stem cell research promises to make have not been realized, but with the necessary funding and the support of people like medical experts, researchers, politicians, and of course you, these advances in medicine can be realized. The Congress passed the Dickey-Wicker Amendment in 1995 to forbid government subsidizing of research that included the demolition of embryos. President Bush affirmed this choice. However, more as of late, President Obama lifted a large number of these confinements due to their potential health benefits that stem cell research allows for. On the off chance that stem cell research were governmentally supported, the administration would be able to clear up guidelines and rules about the utilization of the cash. Consequently, the administration can all the more effectively authorize moral research practices. Government agencies can ensure that all embryos are obtained with consent. These practices are harder to monitor if money is gained from private funding and the government is not directly involved. To move forward, we will address the ethical controversy surrounding stem cell research. The controversy surrounding embryonic stem cell research is that it is immoral, as it involves creating embryos only to destroy them. The overall controversial question here is, when does an embryo become part of humanity? Until an organism has a rudimentary central nervous system and some sense receptors, be it for pain, touch, smell, taste, sight, or sound, it cannot form any contact with the outside world. Many researchers believe that embryos should definitely be respected as the potential to become a human being. However, it is worthy to utilize it for specific kinds of research, given only that there is great logical legitimization, cautious oversight, and educated consent from the woman or couple for giving the embryo for research. A number of pro-life supporters actually advocate for using frozen embryos that remain after a woman or couple has completed infertility treatment and that they have not decided to give to another couple. They actually advocate for embryonic stem cell research. This view is held, for example, by former First Lady Nancy Reagan and by U.S. Senator Orrin Hatch. To me, the morality of the situation dictates that these embryos, which are routinely discarded, be used to improve and save lives. The tragedy would be in not using these embryos to save lives when the alternative is that they would be discarded. So basically, in a clinic, these embryos would otherwise be discarded if they were not donated to science in order to research them for stem cell research purposes. There's also controversy surrounding the adult stem cell research. The more adult stem cell transplants there are, the higher there are for risk of a tumor, is what a lot of people believe in terms of what adult stem research is. According to Biopolitical Times, unfortunately, the reality is that any cell, when given as a transplant, has a risk to form a tumor and other side effects. Adult stem research but I believe that adult stem research pros actually outweigh the cons. In the midst of this discussion, industry advocates have obviously kept on arguing that the treatments are safe, that the dangers are minimal, and the potential advantages are actually extreme. Stem cells such as these are being researched to create new tissue to replace the parts of organs that are damaged by injury or disease. Right now, scientists are using stem cells to treat patients with blood diseases such as leukemia. Adult stem cells are tissue-specific cells that replace the existing stem cells in your organs as they wear out and die, because our bodies cannot supply the correct amount of cells in our body in order to maintain. They wear out and die, and tissue-specific stem cells, such as adult stem cells, are actually transplanted in you in order for you to produce more and keep those in your body. Every year altogether, there are actually improved survival rates for stem cell transplant recipients. Stem cells actually may able to allow you to live more. Now and again, it can even fix blood diseases. Around 50,000 transplantations are performed yearly, with the number expanding 10% to 20% every year. More than 20,000 individuals have now lived 5 years or longer in the wake of having stem cell transplant. Learning information about stem cell research and the risks that go with it are very important to learn about. But remember, one must research a subject thoroughly to form their own opinion on a controversial topic, which can ultimately prove to them to not be controversial at all. Stem cell research does and promises to do more good than bad. Stem cells actually have the ability to save lives. Adult stem research can replace neurons harmed by spinal line damage, a stroke, Alzheimer's disease, Parkinson's disease, or other neurological issues. They produce insulin that could treat individuals with diabetes and heart muscle cells that could fix basically themselves after a heart attack. They replace essentially any tissue or organ that is harmed or diseased. In any case, embryonic stem cell-based transplants can do substantially more. They concentrate on how stem cells develop into heart muscle cells. They could give signs about how we could initiate heart muscle fix itself after having a heart attack, and these cells could be utilized to study infections, distinguish new medications, or screen drugs for toxic symptoms or side effects. In theory, there is no limit to the types of diseases that could be treated with stem cell research, given that researchers may be able to study all cell types via embryonic stem cells. They have the potential to make breakthroughs in any disease. This is actually a quote from the California Stem Cell Agency. So, seeing new drug is amazingly advantageous to today's society, particularly with the new advances always developing. We should all get some answers concerning different practices in drug, new advances, and so on, paying little respect to whether it's from a field that we are unfamiliar with. To recap, we discussed that stem cells have the earth-shattering potential to frame into a wide scope of cell types in the body in the midst of early life and improvement. We have also addressed the controversies specifically surrounding embryonic stem cells, in that many believe that it is shameless, as it includes making embryos just to destroy them. But the truth behind that claim is that many who support embryonic stem cell research are also pro-life and believe that embryonic organisms should be regarded as a potential person, but it is qualified to use it for explicit sorts of research, given just when there is incredible sense of legitimization, careful oversight, and instructed assent from the woman or couple giving the embryo for research, in light of the fact that many times the only other option is for that embryo to be discarded and thrown away. Without embryonic research, we wouldn't have as many treatments or potential future treatments for spinal line harm, stroke, Alzheimer's disease, Parkinson's disease, etc. So please remember, everyone, one must research a subject thoroughly to form their own opinion on a controversial topic, which can ultimately prove to them to not be controversial at all. Sometimes you might realize that the outcomes are much greater than the sacrifices or the possible risks that come with it. I will finish with a quote from Senator Orrin Hatch that says, "I understand that many have ethical and moral reservations about stem cell research, but for the same reason, I describe myself as pro-life. I embrace embryonic stem cell research because I believe being pro-life is not only caring for the unborn, but also caring for the living." Thank you so much for listening.